guys, so welcome back to Gemma's Taboo Health Talks. I just want to start this video off by thanking everybody that reached out to me post the grief videos. I am absolutely fine, guys. I actually feel $1 million since recording those videos. It really did lift such a weight off my shoulders, just being able to speak openly and honestly. I do know that some of you have felt very emotional after watching those videos, and I hope that I didn't cause you too much emotional distress, but it's nice to know that you guys actually, a lot of you have gone through what I'm actually going through and were able to just reach out and just say, it's okay, you're not going mad, because I'd convinced myself at one stage that I was going mad, and that everything will be okay, it just takes time. And I sort of knew that, but I still a little bit feel stuck. I still feel a little bit numb, and I just still feel like I don't have all the answers when that's all I want to have. So I just want you guys to know that I'm absolutely fine. Thank you so much again. You guys are amazing. I didn't realise how much support was out there for me, so I can't thank you enough. You are just another extension to my family. You're my now little Taboo family, so thank you so much for caring and just being there. So guys, today's video, as you can see from the title, is all about the menopause. I have ended the teenage videos, and I feel that it's time to look at some other avenues now of taboo subjects, and the one that has come up quite a lot that has been requested is actually the menopause. Can you talk about the menopause? Can you talk about why it happens? Can you give us like signs and symptoms, just so when we do get to that stage we are ready, and just anything that I know about it really. So I could have done 3 videos like I did for the period one, but I just felt with the period one it was designed for teenagers, and I wanted them to have a really, good understanding. I feel with this menopause one, a lot of us as women will already be prepared for the menopause, will already have done research about it. So I'm not going to do 3 videos, I'm going to do 1 video, and I'm just going to try and make it as interesting as possible. And if there is anything extra that you want to know about the menopause, or anything that I've missed out that you think that I should have covered, I'm very happy then to do another video to clear up any gaps that we may have come across. So guys, let's get started. So I thought about how I would do this, and I thought there's no point changing my style. It works really well. So I'm just going to ask questions. I'm going to ask a question and then I'm going to answer it. So if you, like I said, if I say anything along the way that I missed anything that you really want to know about in the menopause, drop me a comment. I can either shoot another small little video, they take no time at all, and we can get it posted for you. So all the answers are in there for you. So what is the menopause? So the simplest way that I can explain the menopause is when a lady naturally goes through her cycle with her periods, and around the age of 45, 55, in that gap there, a lady will stop producing the hormone that encourages her ovaries to release eggs. She will naturally stop having periods, and will no longer naturally be able to fall pregnant. That's the simplest way that I can explain it. Nice and simple. If there's any clearer way of saying it, let me know. Let me know in the comments. So what causes the menopause? So the menopause is caused by the balance and change of our actual sex hormones that are in our body, which occurs as we naturally get older. So the ovaries will stop producing the hormones, and then our ovaries will stop releasing the eggs. So premature or early menopause can happen at any stage. There is no evidence of why this can happen, but there are operations and syndromes that can cause you to go through early menopause or premature menopause. So they actually are an oophorectomy, so that's basically a removal of an ovary or ovaries, treatment for breast cancer. It can actually be brought on by underlying health conditions. So some people that have Down syndrome can go into early menopause, and also people that suffer from Addison's disease. And this is basically because of their hormones and the medications that they can take to help treat them with the conditions that they have. So guys, the menopause is completely normal and natural, and I know when I speak to some women that are going through the menopause and have been through the menopause, say that there is nothing normal and natural about this. It's horrible, it makes you feel horrendous, and there are a lot of ladies that try and get through the process of menopause in a very natural way as possible, do not take any medication, will use herbal medications to try soften the blow of the symptoms that you can get. So we're going to talk a bit more about the symptoms a little bit later, but just to say, guys, it is completely normal and it is natural. But if you are suffering and you don't feel 100%, you do need to reach out to your GP, and they can actually refer you to see a menopause nurse, menopause actual consultant that is very used to dealing with ladies that are going through their menopause. And there are treatment plans that they can put you on, and again, I will discuss this in a little bit. So I've briefly touched on early menopause or premature menopause, and actually 1 in 100 young ladies under the age of 40 will actually experience this, will actually go through an early menopause. And they also call it premature ovary insufficiency, which sounds really horrible. It's a really horrible name, but it just means that this young lady, this woman, has actually started her menopause early. So guys, what are the symptoms of the menopause? Really good question, and depending where you look, you can get loads of different answers from this, but I always try and get my answers from real good resources. So I use the NHS website a lot when I'm doing these videos to make sure that I'm giving you real factual advice. But I'm sure that if you're someone that is or has gone through the menopause, you may experience this completely different to what the next woman may do. So again, if there's something that I miss here and you've experienced anything different, please leave your in the comments down below. Please leave any experiences that you've had. I think it might be really useful for others to know. So while going through the menopause, some women experience some really severe symptoms of it, and some have very mild symptoms, and you know, for nobody it's going to be the same. Everyone has their own, as we've said before, variation of what they would have experienced. But for some ladies it can be that debilitating that they do just literally have to stay at home, they can't cope, there's a lot of psychological issues that go with it for them, so they end up having a lot of extra treatment outside of just the going through the menopause, because it's really affected them. So if you are someone that is going through the menopause and is really struggling and just finding each day harder and harder, please reach out to your GP, because there are so many able people out there, as in clinicians, that are able to help you and might be able to start you on treatment or give you advice how you can move through this horrible period and come through the end of it. So the common side effects from going through the menopause are hot flushes. So some women will describe hot flushes as it just suddenly comes on, it starts from their feet, goes all the way through their body, spreads like wildfire, and then it's there for a period of time and then disappears again. Some women will describe that they just get hot flushes in their face, their hands get sweaty, and all of those things are really normal and common, and it's actually the one that I found on every bit of research is hot flushes. And the really interesting thing is hot flushes normally start happening before your period stops. So as we've said before, when the early signs that you're going through your menopause is that your period will start getting, it'll either stop very suddenly, or you'll have periods of time where it becomes very irregular. But you will notice that you start having hot flushes before your period stops. Now, this is just standard information, guys. I know that you may experience it completely different, so whatever I say, it isn't Bible, but just take it as these are normal steps that people will go through, but some don't. So if you didn't have the hot flushes but your period stopped, or you had the hot flushes and then things were happening, this is just the information that I'm finding, guys, okay? You may start suffering with night sweats, so you go to bed, nice and dry. Throughout the night you wake up absolutely soaking because your body is just pouring with sweat. And this can be really, again, annoying because it can disturb your sleep. You can completely drench your clothes that you've got on, that you've gone to bed, your bed sheets. So this is something that you should speak to your GP about, because not only does night sweats come with menopause, it actually comes with some other health conditions such as diabetes. So it's really important that if you are experiencing night sweats, that you should always speak to your GP. So guys, vaginal dryness and actually it being really painful when you're having sex. Now, this came up really common when I did loads of research about this, and actually after having the hot flushes, vaginal dryness was the second one that came up on most people's list of experiences that they suffered while going through the menopause. So now, to treat vaginal dryness, you can go and speak to your GP or your pharmacist, and they can recommend lots of really good they can recommend some really good items that can help with this. So by using water-based lubricants when having sex, that can be really helpful to reduce obviously the dryness and also the friction that can be caused by intercourse. So there are vaginal moisturizers that you can use that you need to insert inside the vagina, but it's really important that you just don't go and buy a moisturizer. They have to be one specialized for the vagina. So they can be prescribed. So again, I would speak to your GP and they can give you a list of names that are good. And of course you can research it online, but just make sure that what you are using is correct and it is the one that you should be using for that area. Another really important thing to do is to try and use unperfumed soap down below. This can cause irritation. Again, using soap down below, also using soap on your body in general, can really dry out your skin. So if it's drying out your skin, of course it can dry out your vagina. There are vaginal washes out there that are unperfumed, unscented, good for the pH levels in your vagina. So reach out, find those, and hopefully by doing those steps, that will help reduce the vaginal dryness that you suffer. So another really common thing that came up was women experiencing problems sleeping as they were going through the menopause. So again, this is something that can really cause you issues throughout the day. If you do not sleep properly and you don't sleep properly for a couple of weeks, a couple of days, they use sleep torture. So guys, remember that. If you're a parent and you remember what it's like not to sleep when the babies were first born or little, whatever, you know how difficult it is, how horrible it can make you feel. So again, this is another one. If you are experiencing periods of time where you cannot sleep while you're going through the menopause, you need to speak to your GP. This can cause so many other issues with you if you are not sleeping properly, okay? You can have very mild sleeping tablets. There are also herbal remedies out there that can make you sleep. You know, having lavender sprays, lavender pillows in your room are really relaxing. That can help. Having a nice warm bath before bed. But if you are someone that cannot fall asleep or wakes up halfway through the night and cannot get back to sleep, or having ongoing issues of not being able to fall asleep at all, you must speak to your GP, guys. You have to reach out. You need to get some support through this, okay? So guys, low mood and anxiety again is a really common symptom of the menopause. For a lot of women, they are now going through again complete hormonal changes, and if you remember when you may or you may not remember when you was a child and you were going through your period, the hormonal surges that you were getting when you were just starting puberty, obviously those hormonal surges are now happening and dropping again. So this can really affect your mood, okay, and can make people feel really anxious. And again, this is another thing, okay? If you are getting to the point, guys, where you are feeling so low, so depressed, you know, you can't find any reasoning with yourself, you know, everything is terrible in your life, you really have to reach out to your GP, because they need to know how this is affecting you mentally as well as physically. And there are treatments that you can go on, and there are things that the doctors can refer you to, so counselling, you know, just going through exercise can help lift your mood. But it's really important, guys, if you are experiencing low mood that leads to depression or anxiety, that you just don't stay at home and try and deal with this yourself. You seek medical advice. So guys, this is something that is very private to some people, and it is loss of libido and loss of your sex drive. So as the hormones change within your body, your drive for sex can really change. You may not have that drive anymore, or less of a drive, and just may not want to have sex. Again, what I've been researching, a lot of ladies feel as they then can't produce a baby anymore. Are they really a woman now? It was some really interesting articles that I read around this, and by women's hormones, you know, decreasing the level of the hormone, it can really affect you mentally, as we've discussed, but this can physically affect you because you then physically don't see yourself as a woman anymore. I'm not saying that is for everyone, and you know, I've not been through the menopause, so I'm just speaking from information that I've researched. So tell me how you feel, you know, in the comments below. Tell me what you think about this, because from what I've read, it's all based on hormones and your body changing that can cause this to happen. So guys, the last one that seemed to play a big part in every bit of research that I did was actually problems concentrating and actual memory loss. And again, it comes down to hormones and how that affects our natural balances within our body. And it's really important that we try as much as, you know, throughout any part of our life to keep up our natural vitamins and minerals and things like that. But when you are going through menopause, it's really important to make sure that all your balances of your vitamin D, C's, everything that's in your body, your calcium levels, everything are where they need to be. So it's really important that as you do start your menopause, or when you start experiencing symptoms of your menopause, you really should have a chat with your GP. You can have some blood tests to confirm if you are or are not going through the menopause, and also look at if you're deficient in any areas, and if you do need to have a top up of any irons or any of the vitamins or minerals that we naturally need to function properly. And if you think, if we're not sleeping well because of going through the menopause, or you know, we're having night sweats, it does catch up with you. You know, you can't concentrate properly, you can't focus. So guys, please don't be embarrassed by reaching out to your GP. That's what your GP is there for. They might not make everything 100% right for you, but they might be able to point you in the right direction of how you look after yourself and how you make things better for yourself. So guys, with all this doom and gloom of menopause and all the crap ways that you can feel, there are actually treatments for women that are going through the menopause, and I did discuss this briefly before. So some ladies choose to go through the menopause unmedicated. They will do things very naturally. They will use different remedies that can help with the symptoms that we've discussed, and they feel that's the right course for them to get them through the stages of them going through the menopause, and it didn't affect them and it worked really well. But then for others, this isn't the case, and they do need to go on different treatment plans. So I'm going to talk about those now as well. So there is something called HRT, and this is a hormone replacement treatment. It can come in tablets, skin patches, gels and implants that relieve menopause symptoms by replacing the hormones that you've now that have now decreased in your body. There's actually vaginal creams and lubricants or moisturizers that can also help with the vaginal dryness that we discussed. So you can be referred for cognitive behavioral therapy, CBT, and it's a talking therapy. This can really help with if you are suffering from low moods or anxiety. The doctors will really try hard not to put someone on antidepressants while they're going through the menopause. They try not to give you antidepressants in a lot of whenever you're feeling like this anyway. If there is good evidence that you do need them, of course they will give them to you, but there's lots of things before that they will try before they just dish out antidepressants for you. So guys, as I said, when you have your blood test done, this is looking at, are you going through the menopause, yes or no? But what it's also looking for is those things that we potentially are going to be deficient in right now. So do we have low iron? Do we have low vitamin D? Or C, do I have the good B12? Do I have good calcium? You know, all of those things are going to be being looked at in your blood. So by leading a healthy lifestyle, such as leading a healthy lifestyle and having a healthy balanced diet, that is the key for a lot of things that are going on in our bodies, is just naturally replacing them by eating good foods and by exercising regularly. This is again a big must that keeps coming up when I've been reading, because if your body is fit and well, it can reduce the symptoms of the menopause apparently. So guys, there's a few other symptoms that I didn't speak about just a while ago, because I wanted to break them down, because these things also come hand in hand with other health conditions, and it's really, really important that if you now experience any of the below that I'm going to say, you must speak to your GP straight away. The other things are really important, but when these things are happening, we need to make sure that you are not experiencing any other health conditions, okay? So if you're experiencing palpitations, the heart is the biggest organ in your body that you do not want to fail next to your brain. Okay, so if you're starting to have any complications with your heart, so if you start feeling that your heart is racing, you know, you can actually feel your heart beating, you've never felt it before, you know, you can actually, it feels like your heart is beating out of your chest. If this is an ongoing thing, or it happens and starts and stops, this is a really, really important thing that you need to discuss with your GP, okay? If you're having palpitations that do not stop and have been going on for a long period of time, this is actually quite a medical emergency, and that you need to be seen in A&E, because if your heart is racing and is not slowing down, your heart is a muscle. It needs to be able to relax and work at a steady pace. So if your heart is just going 10 to a dozen and is not stopping, then you need to get straight to A&E, okay? You need to get yourself examined, and you need to see what is going on with your heart. So please, 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 please take it very seriously if you are someone that is experiencing palpitations that are going on for a long period of time. If you're someone that suddenly just gets a little flutter, that can happen with the electrical waves that we have within our heart. But if it's going on for a long period of time in the same space, like it's just started and it's gone for a couple of minutes and it's getting longer and longer, please get yourself off to hospital straight away, okay? It can be very normal within the menopause that you have this. Again, it's just the influx of different hormones, the body changing, the deficiencies that we may experience, but please take this one very seriously if you are experiencing it. So as we get older, you know, our body doesn't do what we want it to do. So for some people, we may start experiencing joint stiffness, muscle aches, but again, there are serious arthritises that come as we get older. So if you are someone that's starting to experience really sore joints, you know, you're suffering with muscle complaints, again, this is really important that the GP knows about this, especially if they're longevity, especially if they've been around for ages, and especially if they're causing you debilitating times and you can't do what you normally need to do. We need to know as clinicians what is going on with your body. If you are starting to suffer with arthritises, if your bones are wearing down, if there's any problems with joints, this is something really serious that can affect you long term that we need to know about very soon, okay? Reduce muscle mass, guys. So if you are someone that is feeling very low in mood, doesn't want to go out anymore, is now not doing very much, your muscle mass will reduce, okay? But if you are going through the menopause and you've started to notice that you're getting muscle wastage and things like that, again, very serious. We need to know about these things, okay? It might be nothing to actually do with the menopause, but these are things that women experience. They feel that they experience when their menopause comes on, but it's actually got something to do with other underlying medical conditions that is actually arisen from the start of their menopause. Okay, it's actually surfaced at the same sort of time that they're having their menopause. So please guys, please see your GP or your menopause specialist or whoever it is and talk to them about muscle wastage or noticing that your muscles are becoming weaker, and you may suddenly start feeling that you're falling more. These are really important things that people need to know about so they can assist you with. So when women are going through the menopause, there's a high rate of UTIs, so they keep getting reoccurrent UTIs. Again, there's no real reason for this because of the menopause other than the hormonal balances in changing, vaginal dryness, those type of things, yes, can cause urinary tract infections if you're not wiping properly. But again, if it's reoccurring and it keeps coming, again, we need to look at, is there anything wrong with the kidneys? Is there anything wrong with the urethra? There needs to be more investigations to see why you are getting reoccurring UTIs. Could be very simple, as we've said. May not be wiping in the right direction, maybe because of the vaginal dryness, maybe because friction of having sex can cause UTI. So guys, these are 4 really serious things that people experience through menopause that for some reason surface at the same time as menopause, but are actually linked to underlying medical conditions that they didn't know they had. So please, like I keep saying, please reach out to your GP if you experience any of those 4 things that we've just discussed throughout your menopause. As a woman that has gone through her menopause, you are at increased risk of suffering osteoporosis. I hope I've said that right. I am actually the worst nurse when it comes to pronouncing things, so I'm so sorry if I've said that wrong. And that's actually caused because of the lower estrogen levels that you actually now have within your body. It produces weaker bones, and it can become quite dangerous for people that do suffer from it. But again, there are ways to stop and reduce this, and actually taking HRT is a really good way of preventing this bone weakness happening, this bone breaking down basically. Exercising regularly and keeping your weight down, eating a healthy diet, making sure that you're having natural calcium within your diet, making sure again that you are not deficient in any of your vitamins and minerals that can cause problems with bone healing, and making sure that you actually are 100% at all times within yourself that can keep your body nice and strong. Guys, make sure you're getting that vitamin D. Make sure you are naturally exposed to sunlight. I'm not saying go and put yourself on a sunbed, because we know that the rays from a sunbed can be very dangerous to your skin, but being able to have a good controlled recommended time of sitting outside in the natural sunlight is amazing for your skin. Natural vitamin D is absolutely amazing, and that is something that you are highly recommended to do. Enjoy the sun while you can, and it will make you feel amazing. And as you know, vitamin D is a really good source of keeping your bones nice and healthy and strong. So guys, go and enjoy those sun rays. So like everything guys, stop smoking, stop drinking alcohol will have some type of benefit on your body. For whatever reason, these are, I'm not preaching because everyone will do what they want to do, but these are toxins that you're putting inside your body. It's like when you eat rubbish food, it's a toxin. It doesn't give your body any nutrients or any goodness. So guys, just bear that in mind. And again guys, make sure that you are taking calcium and vitamin D as you go through menopause and when you come out of the menopause, because this will really help your body. So guys, as I've discussed with you, when you do start the menopause, you should always go and see your GP. You should go and have a chat with them, because it's really important that they monitor your blood levels, that they check that you're okay. So when you have your first initial appointment with your GP, they're going to discuss with you having bloods done. They're going to tell you, you're going to come back, and then they're going to tell you if you are or you are not going through the menopause. If you are not going through the menopause and feeling the way that we've discussed, they will obviously look at why this is happening for you. But if you are going through the menopause, they are now going to discuss with you, do you need to start hormone replacement treatment? What type of hormone replacement treatment is there? Because there is the combined hormonal treatment that has both of the hormones in it, and then there is just the one single hormone replacement treatment with the one hormone in it. So they will discuss with you which is the best for you. They will obviously prescribe that for you. They will do your blood pressure. They will get a baseline of what your norm is before you've started treatment. Then they're going to review you after 3 months. And at that 3-month check, what they actually want to know is how your symptoms are and if they're actually under control or not. They're going to talk about side effects that you're experiencing potentially from the medication and symptoms that you still or are no longer experiencing. And also we're going to talk to you about your bleeding patterns. So bleeding patterns in your period, have they completely stopped or are you still having them? So they're going to review the type of HRT that you are on, and they're going to make any necessary changes to that treatment plan as well, if it hasn't worked for you or if it's working great or if there needs to be any tweaks made to it. And then what will happen is they will also do your blood pressure, they will monitor your weight as well, and this will happen 3 months post you taking the treatment, and then they will have yearly reviews of you. And in your year review, they will start talking to you about when they can stop HRT, when they can actually, take you off this program, because you won't need to be on it forever. And some ladies, feel that the HRT makes them feel really normal again. So that will be discussed with you, with your specialist, and they will be able to discuss if and when and how long you need to be on this treatment for. And guys, as I said before, some ladies choose not to go down the medical route at all, and for getting the treatment that they need, they will use herbal remedies and will seek even Chinese medicines. There's lots of different remedies outside of the normal traditional medication. So if you are someone that really doesn't want to go down being medicated, then please research the remedies that are available for you to be able to get you through the menopause. So guys, I've really looked at symptoms and treatment in this. There are so many other things, and what the menopause is. There are so many other things that we could discuss and look at, but I really want to focus on different subjects now each week. So if there was anything that was missed that you would like to know more about regarding the menopause, please reach out. There are so many other topics within menopause that I could pick up with you guys, but I really just don't want to make these videos so boring that people switch off, because I found within the period videos, the amount of people that watched the first one wasn't the same within the second or the third. So I wanted to make this basic understanding the menopause, the treatments that are out there, the side effects for it, and obviously there are complementary medications and treatments that you can have. So if there is anything more that you would like to know, I am very happy, like I said, to do short videos on any topic at all. So please reach out, guys. Let me know if there's anything that I've missed that you would like me to talk about, and we can get those videos out there for you. So guys, again, thank you so much for your support, your love, your comments, the messages that I receive. Just thank you. So like I will always say, guys, please watch this video, please like this video, please share this video, because you do not know who this video is going to help along the way. And if you really like me, please subscribe. As I say, guys, I'm going to do ranges of videos. My videos are going to be about taboo subjects because these are things that people do not like to talk about. Okay, the menopause is one of the ones that's been highly recommended. The menopause changes so much for people. It can change how they view themselves. It can make them feel that how other people view them. It can affect their relationships mentally and physically with their partner. It can be a really traumatic time for some women to go through. Their body is changing, how it changed as they went through puberty, and it's just a complicated time for some women. So do not feel you are alone. Please reach out and talk to people, because it is really important that you go through these things not alone. Okay, anytime that you're going through a massive change within your life, you need to have someone to talk to. And from what you're feeling, someone else may have felt. Okay, from what you're going through now, someone's already potentially been through it and can give you some tips how to cope with it. So please reach out to the people that you need to reach out at the right times, okay? Because you want that support from day one. You want that support and you want that guidance from day one, because from day one till the time that you go and get it, you could have been experiencing things really drastically and you just didn't need to. So look after yourself, okay? The first and be all of everything that I will ever tell you is look after yourself, because if you cannot look after yourself, you cannot look after anybody else. And it's the same as love yourself, because if you do not love yourself, nobody else can love you. So guys, I have covered menopause today. I'm going to do a male subject next week, so that'll be something relating to men, obviously, because it's male. But yeah, that's how I want to do it for a little bit. I'm going to do some taboo subjects like female, male, and then if anyone wants to recommend anything, I'll have a look where I can fit that in as well. So guys, have the most amazing weekend. I believe, you know, we're coming into a very hot week in September, so enjoy that if you're still off school, on holiday still. And if you're a mum or dad that their kids have gone back to school, congratulations. I know that's been very hard. My little one starts school on the 21st of September. I actually cannot wait. He has been at home since March. I've been working at home with him at home, and it's been very, very challenging. So enjoy that time where you can just focus on yourself for a period of time. So guys, be happy, be good, and please reach out, please subscribe, and I will catch you next week when we're talking about something for the males. So bye guys.